The arrival of the Dutch expedition vessel, MV Hondius, off the coast of Tenerife, marks a critical turning point in what has become one of the most complex maritime health crises in recent years. After weeks of isolation in the South Atlantic and a tense standoff near Cape Verde, the ship's 147 passengers and crew are finally beginning a highly regulated disembarkation process. This development follows the confirmation of a Hantavirus outbreak on board, specifically the Andes virus strain, which has claimed 3 lives and left several others in critical condition. The situation began in early April when the vessel departed from Ushuaia, Argentina, the southernmost city in the world, for a 35-day voyage intended to reach Antarctica and several remote islands, including South Georgia and Tristan da Cunha. While the expedition was designed to offer travelers access to some of the most isolated ecosystems on the planet, it instead became the site of a rare and deadly biological event. For those on board, the journey transitioned from a luxury adventure to a period of forced confinement as international health agencies worked to determine the extent of the viral spread. +4 hantaviruses are a family of viruses spread mainly by rodents, and they are typically associated with specific geographic regions and host species. In the Americas, these viruses are known to cause hantavirus pulmonary syndrome, a severe and often fatal respiratory disease. What makes the current outbreak on the MV Hondius particularly concerning to global health officials is the identification of the Andes strain. Unlike most other hantaviruses, which require direct contact with rodent excrement or the inhalation of aerosolized particles from infested areas, the Andes variant has demonstrated a rare capacity for limited human-to-human transmission. This biological characteristic transformed the cruise ship, a confined environment with shared air systems and close living quarters, into a high-stakes laboratory for epidemiologists. While the World Health Organization and the European Center for Disease Prevention and Control have emphasized that the risk to the general public remains low, the specific conditions on the vessel required a Level 3 emergency response from the United States Centers for Disease Control and Prevention. +4. The geographic timeline of the outbreak underscores the difficulty of tracking such a pathogen in a mobile population. After leaving Argentina on April 1, the ship visited multiple locations where passengers may have interacted with local environments. However, investigators are focusing on the period before the voyage began. Current epidemiological data suggests the outbreak likely originated with an index case, a Dutch citizen, who had spent 4 months traveling through rural regions of Chile, Argentina, and Uruguay before boarding the ship. This individual began showing symptoms of fever and gastrointestinal distress as early as April 6. By the time the vessel reached St. Helena on April 24th, the situation had escalated significantly. The body of the first victim was removed at that port, but the true nature of the illness was not yet confirmed by laboratory testing, leading to a period of uncertainty that may have allowed further transmission among those in close contact with the symptomatic individuals. As the ship now sits anchored off the Canary Islands, the focus has shifted from containment to a massive logistical operation involving multiple nations and the highest levels of international health oversight. The core of the international response has centered on the verification of cases and the coordination of medical evacuations under extreme biocontainment protocols. As of the latest update from the World Health Organization, there are 8 linked cases involving the MV Hondius, including 6 laboratory-confirmed infections and 2 probable cases. The fatalities include a Dutch couple and a German national, with the case fatality rate currently estimated at approximately 38%. The clinical progression of the disease on board has been described by medical officials as rapid and severe. Patients typically presented with initial flu-like symptoms, including high fever, myalgia, and nausea, which quickly escalated to acute respiratory distress syndrome and shock. One of the most significant developments in the core investigation was the infection of the ship's doctor, a fact that highlights the risks faced by first responders in confined settings. The doctor, a 65-year-old German national, reported symptoms on April 30th and was later confirmed positive for the Andes virus via polymerase chain reaction testing conducted in the Netherlands. +2. The role of diagnostic laboratories has been pivotal in managing the crisis. Initial testing was hampered by the remote location of the vessel and the lack of specialized equipment on board to identify rare viral pathogens. It was not until the medical evacuation of a 69-year-old British passenger to a high-security intensive care unit in Johannesburg, South Africa, that a definitive diagnosis was reached. On May 2nd, the National Institute for Communicable Diseases in South Africa confirmed the presence of hantavirus through genomic sequencing. This confirmation triggered a cascade of diplomatic and public health actions across Europe and North America. In Switzerland, authorities at a facility in Zurich confirmed that another passenger who had disembarked earlier was also being treated for the virus. These scattered cases forced agencies like the UK Health Security Agency and the Singapore Communicable Diseases Agency to launch extensive contact tracing operations for any individual who had shared flights or port facilities with the original group of passengers. +3. The maritime logistics of the crisis revealed significant gaps in international health regulations for cruise vessels. When the MV Hondius sought to dock in Cape Verde, local authorities denied disembarkation, citing a lack of specialized medical infrastructure to handle a potential viral outbreak safely. This led to several days of the ship being effectively held hostage by the virus in the Atlantic, as described by some observers, while negotiations continued between the Dutch government, the cruise operator Oceanwide Expeditions, and the Spanish Ministry of Health. The eventual decision by Spain to allow the vessel to anchor off Tenerife was based on humanitarian principles and international law, but it came with strict conditions. The evacuation process is not a standard docking. Instead, it involves small launch boats carrying groups of 5 to 10 people to shore, where they are immediately moved to a secure airport zone. This bypasses the local population entirely, a measure insisted upon by the Canary Islands regional leadership to prevent any possibility of the Andes strain entering the local community. Prevention and future surveillance remain the primary focus as the disembarkation continues through its final phases. Public health guidance for those returning from the MV Hondius is exceptionally rigorous due to the long incubation period of hantaviruses, which can range from 1 to 8 weeks. Even passengers who currently show no symptoms are being treated as high-risk contacts. Upon arrival in their home countries, travelers are facing varying levels of mandatory observation. For the 17 United States citizens on board, the CDC has arranged for transfer to the National Quarantine Unit at the University of Nebraska, a facility equipped for high-consequence pathogens. French nationals will undergo 72 hours of hospital monitoring followed by a 45-day home quarantine. These extended periods are necessary because a negative test result shortly after exposure does not rule out the possibility of the virus developing later. Health officials emphasize that while the Andes strain can spread between humans, this usually requires prolonged, intimate contact, and there is no evidence of the virus circulating in the general communities of the port cities visited by the ship. +3. The mechanisms of hantavirus transmission are a key part of the public guidance being issued by agencies like the ECDC. In a standard terrestrial setting, prevention focuses on rodent control and the safe cleaning of areas where mice or rats may have nested. Officials advise against sweeping or vacuuming dry droppings, as this can loft viral particles into the air where they can be inhaled. Instead, the use of wet cleaning methods with bleach is recommended. On a vessel like the MV Hondius, investigators are looking into whether the virus was introduced via contaminated cargo, or if the initial infection on land simply spread through close human contact during the voyage. Once the remaining passengers have been evacuated, the ship is scheduled to sail to Rotterdam in the Netherlands for a comprehensive disinfection process. This will involve specialized crews using professional-grade virucidal agents to ensure all surfaces and ventilation systems are cleared of any biological threat. +3. As the international medical community monitors the surviving patients in South Africa, Switzerland, and the Netherlands, significant questions remain about the long-term implications of this outbreak for the cruise industry. Genomic sequencing is ongoing to determine if there are any mutations in this specific cluster that influenced the rate of transmission on the ship. For now, the World Health Organization maintains that the risk to the wider public is low, provided that contact tracing and quarantine protocols are strictly followed. The situation serves as a stark reminder of the challenges posed by rare pathogens in a hyper-connected world and the necessity of coordinated international responses. For more updates on global health reporting and surveillance, consider following this channel for the latest developments. This concludes the report on the MV Hondius Hantavirus cluster. The core developments of this crisis revolve around the intense coordination between European health ministries and specialized high-containment laboratories across 2 continents. Central to the investigation is the verification of the pathogen's identity, which remained a point of extreme uncertainty during the vessel's transit through the South Atlantic. The World Health Organization has now officially linked 8 cases to the MV Hondius cluster, comprising 6 laboratory-confirmed infections and 2 cases classified as probable. Among the deceased are a Dutch couple and a German national, with clinical reports indicating that the onset of symptoms was atypically rapid for hantavirus. Medical logs from the ship, shared with international investigators, show that patients progressed from initial fever and gastrointestinal complaints to acute respiratory failure within a window of 48 to 72 hours. This aggressive clinical profile prompted the United States Centers for Disease Control and Prevention to escalate their involvement to a Level 3 emergency response, a designation reserved for outbreaks with significant potential for international impact. The diagnostic breakthrough occurred not on the ship, but in a high-security isolation ward in Johannesburg. A 69-year-old British passenger, whose condition had deteriorated while the ship was near the African coast, was airlifted under biocontainment protocols to the National Institute for Communicable Diseases in South Africa. It was here, on May 2nd, that genomic sequencing first confirmed the presence of the Andes virus strain. This specific confirmation changed the nature of the international response, as the Andes strain is one of the few hantaviruses documented to have a capacity for human-to-human transmission. Following this discovery, a second confirmation arrived from a laboratory in the Netherlands, which had been processing samples from the ship's medical officer. The 65-year-old German doctor, who had been treating the initial patients in the ship's infirmary, tested positive via polymerase chain reaction after reporting symptoms on April 30th. The infection of a medical professional in a controlled environment provided the clearest evidence to date that the virus was spreading within the confined quarters of the vessel. The logistical standoff that followed the laboratory confirmations exposed a significant rift between maritime operators and national health authorities. For several days, the MV Hondius was effectively denied entry to multiple ports, most notably in Cape Verde. Local officials there cited a lack of specialized intensive care infrastructure and the high risk of environmental contamination as reasons for refusing the vessel's request to dock. This period of forced isolation, characterized by some international observers as a hostage situation, only ended when the Spanish Ministry of Health, in coordination with the Canary Islands regional government, agreed to a highly restricted humanitarian evacuation off the coast of Tenerife. The protocol for this evacuation is unprecedented for a commercial cruise vessel. It bypasses standard port facilities entirely. Passengers are being moved from the ship to the shore via small launch boats in groups of no more than 10, strictly separated from any local personnel, and transferred directly to a secure zone at the local airport for immediate repatriation. Simultaneously, health agencies in Switzerland and the United Kingdom have been tracking individuals who disembarked from the MV Hondius at earlier stops, before the full scale of the outbreak was understood. In Zurich, a passenger is currently being held in a high-security isolation unit after presenting with symptoms consistent with the Andes virus, while the UK Health Security Agency has initiated contact tracing for those who may have shared air travel with the evacuated British national. The shipping company, Ocean-Wide Expeditions, has maintained that it followed all existing health protocols during the voyage. but the company now faces intense scrutiny regarding the time frame in which it notified international authorities of the initial illness. As the laboratory data continues to be analyzed, the focus remains on whether the index case, the Dutch traveler who had visited Chile, Argentina, and Uruguay, introduced the virus to the ship's internal environment, or if the pathogen was present in cargo or supplies loaded in South America. The resolution of the MV Hondius crisis does not end with disembarkation. Rather, it initiates a high-stakes period of clinical surveillance and environmental decontamination that will last for months. Public health authorities are operating under the strictest protocols due to the unique properties of the Andes virus strain. Unlike other hantaviruses, the Andes variant requires an extended observation period because of its documented incubation window, which typically spans between 1 and 8 weeks. For the 147 individuals who were on board, the transition from the ship to their home countries is merely a shift from one form of isolation to another. In the United States, the Centers for Disease Control and Prevention have mandated that the 17 American passengers undergo evaluation at the National Quarantine Unit in Nebraska. This facility is specifically designed to handle high-consequence pathogens, providing a level of biocontainment that standard municipal hospitals cannot maintain. Simultaneously, French health officials have established a 45-day home quarantine for their citizens, punctuated by mandatory daily symptom reporting and localized medical checks. This duration is critical. A passenger could remain asymptomatic for over a month before suddenly developing the rapid onset pulmonary distress characteristic of the virus. The practical guidance for prevention remains centered on the mechanics of viral transmission, which must be clearly understood to prevent further clusters. Hantaviruses are primarily shed in the saliva, urine, and feces of infected rodent reservoirs, specifically the long-tailed pygmy rice rat in the case of the Andes strain. Transmission to humans most commonly occurs through the inhalation of aerosolized particles. When dried rodent excrement is disturbed, the virus can become airborne in dust. For travelers and researchers in endemic regions of South America, the primary takeaway is the avoidance of settings where rodents may have nested. Public health agencies advise that anyone entering cabins, sheds, or storage areas that have been closed for extended periods should utilize professional-grade respirators and ensure thorough ventilation. Furthermore, cleaning should never involve dry sweeping or vacuuming, which can loft the virus into the breathing zone. Instead, surfaces should be saturated with a disinfectant solution, such as 10% bleach, to neutralize the pathogen before it is physically removed. On a maritime vessel, like the MV Hondius, these principles are being scaled to an industrial level, with specialized crews utilizing high-output virucidal fogging systems to treat the ship's internal air ducts and shared social spaces. Ethically, the confinement of the MV Hondius has reignited a global debate regarding the balance between individual liberty and collective biosecurity. The terminology used during the standoff, with some media outlets describing the passengers as being held hostage by the virus, highlights the tension inherent in modern quarantine law. From a public health perspective, the restrictions were an absolute necessity to prevent a potential superspreader event involving a virus with a 38% fatality rate. However, the psychological impact on those confined to their cabins for weeks cannot be overlooked. Officials acknowledge that the limits of current scientific knowledge contribute to this tension. For instance, it remains unknown whether individuals can transmit the Andes virus during the incubation period before symptoms appear. Until this biological uncertainty is resolved, the most conservative approach, strict isolation, remains the global standard, as the MV Hondius prepares to sail toward Rotterdam for its final decontamination. The international medical community continues to monitor the survivors for long-term complications, such as impaired renal function or chronic respiratory issues. The data gathered from this outbreak will likely inform future international health regulations for the cruise and expedition industries, potentially leading to mandatory